Welcome to the SIBO Doctor Podcast with Dr. Nirala Jacoby, a US-trained naturopathic physician and director of SIBOtest.com, an online breath testing service and education portal for practitioners. In this podcast series, medical experts join us to discuss functional digestive disorders, clinical practice, and research as it relates to small intestinal bacterial overgrowth and associated conditions. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. If you're a practitioner and want to learn the basics of SIBO, head over to thesibodoctor.com for SIBO education such as the SIBO Fundamentals course, masterclasses, group mentoring, and much more. If you're a patient, please know this information is not intended to diagnose or treat a medical condition. Please ask your doctor before initiating any new treatments. And now, over to Dr. Jacoby and the SIBO Doctor Podcast.
Welcome, SIBO practitioners, to another episode of the SIBO Doctor Podcast. And with me today, I have Dr. Greg Nigh, who co-founded the Immersion Health Center in 2014 after completing both the Naturopathic Doctor program and the Master of Science in Oriental Medicine program. During his early years of work, he developed his interest and passion for researching and implementing alternative cancer therapies. Dr. Nigh is widely respected in the naturopathic profession and has spoken several times at the annual convention of the American Association of Naturopathic Physicians and the National Conference on the Oncology Association of Naturopathic Physicians on cancer cell metabolism. He's a prolific reader, researcher, and writer, and has also contributed a chapter to the upcoming 2-volume Foundations of Naturopathic Medicine textbook that we've all been sort of waiting for a while. And recently, Dr. Nigh and I both presented on the SIBO SOS Summit that was put out by Siobhan Sarna and has reached thousands of potential SIBO patients. And I was really impressed with his talk on hydrogen sulfide, and it's been something on my mind. I've mentioned it in many podcasts before about hydrogen sulfide, it being the sort of third gas besides hydrogen and methane that we suspect in SIBO, but we can't as of yet really test for it on a breath in a breath test. So I thought I'd invite him on the show and talk to him about sulfur metabolism. He has some really unique ideas about hydrogen sulfide and sulfur imbalances. So, Dr. Nigh, welcome to the podcast.
Thank you so much. I'm psyched to be talking to you.
Okay, so let's kind of dive right in. Just a little bit more of a preliminary sort of stage setting. Hydrogen sulfide has been sort of a friend and foe when we look at research. There's research that suggests that hydrogen sulfide production in the gut can be both protective but also can lead to pretty serious issues like intestinal permeability and is also linked to colon cancer, ulcerative colitis. So it's kind of like one of those things that can wear a number of hats. And what I really want to kind of talk to you about is the sulfur metabolism and your unique approach to it, but also the bacteria that produce hydrogen sulfide or sulfur-reducing bacteria. So let's kind of start how you actually landed in this whole hydrogen sulfide soup.
Oh gosh, let's see it started. There's a researcher, Stephanie Seneff, that a lot of people might know of her. She's at MIT and she's written a lot about sulfur. And she had published a few papers that I read, and I was just sort of blown away by what she was saying, not just about sulfur, but a lot of things. She's a very creative thinker. And so I just sent her an email and said, wow, those are great papers. And so we ended up in a correspondence, and anyway, I'll try to fast forward all this. She was interested in some of my clinical stuff, and we set up and had some conversations on the phone. And she was telling me about a lot of problems that happen with sulfur metabolism, especially in a toxic world where sulfur in our bodies can get bound up by all kinds of toxic things because it chelates so well. And it so happened that the nutrition therapist that I work with, Maria Zilka, she was sitting in the room and could hear half of the conversation about, as I was talking, just, trying to understand the way that sulfur messes things up. And Maria is certified as a GAPS practitioner. She implements the GAPS diet, which in her experience, there were people who were doing GAPS. Some people did fabulous on it, but there were a number of people who they do well for about a week and then they just crash on the diet. And they stayed on the diet thinking that they were doing detox, but in fact, they were just not getting better. And it occurred to Maria, wait a minute, the GAPS diet is loaded with sulfur.
Mm-hmm.
I mean, it's a very high sulfur diet. And so we kind of cobbled together this protocol where we would radically dietarily lower sulfur intake, and we would give this set of nutrients that could just sort of help speed the outflow of these various metabolites that we'll be talking about. And we put these people on this protocol, and it was just astounding how their health was transforming sometimes in a matter of a day or two. It was really crazy. And so that was sort of our first eye-opening, oh my gosh, there's something going on with sulfur. And so we just expanded that. And of course, I've just kept doing my geeky thing and trying to understand what's really happening metabolically here, and what are the things that feed into it, and how does it drain out, and all those things. And so we just kept trying it with more and more patients who seemed to be fairly unresponsive to other things that they should be responding to. And it was sort of crazy how many different conditions were responding to this protocol of just a low sulfur protocol. And it got to the point where anybody who walked in and it didn't seem obvious what was going on, we just put them on this protocol to see what happened, because a large number of them were getting better.
So it didn't matter if they had digestive issues, so you just sort of...
It didn't really matter, yeah.
Interesting.
And we came into, there's sort of a picture of a sulfur person, that we sort of, over time we've gotten to the place where, you just ask a few questions and you just look at somebody and you say, oh yeah, that's a sulfur thing. And so, we end up using it with lots of patients, certainly anybody with kind of an inflammatory bowel.
In terms of gut issues, you were looking for inflammatory bowel disease and mainly ulcerative colitis, I would assume.
But really anything. People that have any kind of ongoing irritable bowel, or just their gut isn't right. They've had reflux, or they have just, they just know something's not right in there. And of course, also the people that have ulcerative colitis and Crohn's disease and, the extreme stuff, but not necessarily extreme stuff. And so we would just put them all on this protocol, and it's not like it fixed everybody, but a oddly high percent of people who we were doing this with were getting either somewhat or dramatically improved, often within a span of 2 or 3 days of being on this protocol. And so, then it's all right, so what's happening here? How could this be? And so that has been, kind of this concurrent study of trying to understand why this would work so well. And what I've come to believe is that sulfur problems are in some ways sort of like the canary in the coal mine of kind of toxicity in general, just because of the role that sulfur plays in detoxification. It's like when it's over there in phase 2 in the liver, it's, you want sulfur to be binding to all kinds of things. But when it's over here, maintaining the structural integrity of the body and the connective tissue, when it's lining every surface with heparan sulfate proteoglycans, that sulfur is not supposed to be bound up with anything, because it has a very specific role that it needs to be playing. But now we're exposed to just so much stuff, and not just metals, but also metals, but also the organochlorides and all kinds of things bind to sulfur. And when sulfur gets bound up, it just causes all kinds of problems.
So if I can just interrupt, just so that clarify. So what you're saying is that the demand for sulfur is greater now than it's been pre-industrial revolution, perhaps, when we are now experiencing all sorts of exposures that we never experienced before. So my question about that would be, okay, so we have an endogenous sulfur metabolism or production, well, maybe not production, but processing. And then we also have bacterial production or sulfur-reducing bacteria. So how do those two fit in?
Yeah, great. So sulfur in the body, it's all dietary. That's all of our sulfur exposure. So sulfur comes in its various forms, and ultimately the body has to get a large portion of that sulfur into the form of sulfate, SO4. And so very little sulfate is in our diet. It comes in these other forms, and it's got to get to sulfate through enzymatic activity. And there are various things that happen that prevent dietary sulfur from making its way to sulfate. But the problem is we have to have a constant supply of sulfate. I mean, our bodies, we can't lack sulfate. It is what, all the heparin sulfate in the body, which every surface is lined with heparin sulfate. We need a constant, ongoing supply of sulfate. If we can't get to sulfate, then we have to do a workaround. Like, bodies are intelligent, and if they can't make sulfate, they're going to figure out something else to do in order to get the sulfate, if you can't make it directly through enzymatic action.
Are we talking about CBS pathways, or what are the pathways exactly that usually get challenged with or are utilized through this process?
So dietary sulfur comes in and is partly through bacteria or through enzymatic action, gets liberated, and then it has to go through a series of oxidation steps. So you've got to climb the ladder from either elemental sulfur, just dietary sulfur, or elemental sulfur. You got to get it oxidized up to SO4, and so there are these enzymatic reactions that ultimately do that. PAPS is the activated form of sulfate, but in order to get there, CBS is one of the pathways that sulfur can go down if it's not going to sulfate. So sulfur also is going to be used to build glutathione, and it's going to build taurine, and CBS will generate hydrogen sulfide as another byproduct. But that is in the sulfation pathway. In the digestive pathway, it is through a series of oxidative steps that transform, for instance, sulfur dioxide, which can come in dietarily in small amounts, or even thiosulfur that can come in, that will be transformed often by bacteria into hydrogen sulfide and sulfite. Those will get directly oxidized to SO4. Mm-hmm. So H2S will get oxidized to SO4. SO3, obviously, easily oxidized to SO4. And then once it's as SO4, the enzymatic action of PAPSS is this long-named enzyme that translates inorganic sulfate into biologically active PAPs. And that form of sulfate is the one that the body needs. Mm-hmm. But this is a very long process. And if anything interrupts, or not a long process, but it involves multiple steps. And if anything comes in and interferes with the steps that get you to PAPs, then you have to figure out another way to get there. And there we'll go into, there are lots of things that will interfere with the ability to get to PAPs, which means the body has to figure out a workaround.
Right. And so when people, just trying to understand, so when people are actually reactive to sulfur, or let's say sulfur-containing foods or thiols, they're not having a very efficient process that ends up in PAPs.
Correct.
And so they're actually reacting to these byproducts of this metabolism. Is that correct to say?
So what I think is happening, and I think, and this is really, Stephanie is really, it's just been through many conversations with her, and a lot of this is her original idea that I've kind of taken over and just sort of see how much it plays out clinically, and I think it does. That if we can't get PAPs generated in the gut, where it can get produced and heads through the portal vein to the liver, and the liver does all of its sulfur stuff using that activated form of PAPs. If you can't do that, we overgrow the sulfur-fixing bacteria, because they will start generating higher levels of hydrogen sulfide and sulfite. We need those things because they can be directly oxidized into sulfate. And so when we generate these toxic byproducts, they're symptomatic, which is a bummer, but they will get into the blood, and the mitochondria in the disseminated cells of the body can directly oxidize those things to sulfate. And that allows the cells to have access to sulfate. So the overgrowth of these bacteria, I believe, in many cases, is an adaptive overgrowth, which is why I think just trying to kill off bacteria is going to ultimately not be a long-term successful program.
Well, how do you, because I, somebody who's worked with people with high desulfovibrio and so forth, bilophilia, and they're really extremely high, especially on the Genova GI effects that does measure desulfovibrio, and many of my patients are just way over in the red, and they do have, they do improve when we do the dietary. When I first started, I looked at the research that showed that high animal fat, especially dairy fat, and high animal products actually increase desulfovibrio, and bile acids as well. And so I started to actually, before I removed sulfur, I actually would work with those kind of classic high paleo, high meat eaters and reduce the animal fats and animal proteins. And, that sort of, I can't say I had miraculous results like you talk about, but a few patients come to mind that had immediate improvement when we did that. So I'm just trying to, because your approach is so revolutionary in terms of that it's actually an adaptive process, and that we need these bacteria to produce hydrogen sulfide when we're on the other side of the fence saying, hey, they're causing damage, they're causing symptoms. So how do you reconcile that?
Yeah, how do you reconcile? Yeah, it's a good question. But ultimately, I think that the problem has come because of toxicity. I think that there are a lot of reasons that our sulfate production can be shut down. And one that I've written a lot about and have done a lot of research on is with glyphosate, because it is such a direct hit to sulfur, to sulfate production in the body. And of course, it's ubiquitous. We are all exposed to glyphosate, and it doesn't matter, even those of us who eat organic as much as possible, we still have glyphosate in our system. And glyphosate will, through just a crazy number of different mechanisms, kind of all these different mechanisms that inhibit sulfate production ultimately. And that's through chelation of minerals that are needed for sulfate production, through interference of very specific amino acids that need to be involved in, this whole sulfur cycle, and I think just displacement of the cofactors. Molybdenum is a cofactor in the sulfide oxidase, this key enzyme for getting sulfite converted to sulfate, and glyphosate can displace the molybdenum through chelation. I mean, so many ways that glyphosate comes into the picture and can bring sulfate production to, I mean, it couldn't be to a halt, but at least slow it down in a big way. And that leaves our body starved of sulfate. And in fact, I mean, I personally think that this ricochets out through not just digestive issues. I think cancer can be very closely tied into this whole issue as well, and any number of other diseases. Stephanie's written about this a lot, and she and I wrote about recently just the relationship to gout and some related diseases there, and also anencephaly, and just so many different ways that glyphosate comes into this picture, but its impact on sulfate is profound. So that leaves our body in this place where, well, what do we do? Like, we got to have sulfate. And so it makes sense to me, just given how intelligent this whole crazy system is, that if it can't get sulfate, the workaround seems quite straightforward. That, oh, well, if we just grow these bacteria, they'll get the sulfate for us.
It's so interesting. Just for those listeners who are unfamiliar with glyphosate, it's basically the active ingredient in Roundup, really, really toxic herbicide. And so what you're saying is you're using, in a way, I don't know if you actually do any kind of, I'm assuming you do some stool testing, and if that bug shows up either on a ubiome or any of these other PCR tests, you would think of that as actually maybe a marker for toxicity, rather than they need to change their diet to, let's say, less animal products or less sulfur containing foods.
Yeah, I would say, I guess I wouldn't necessarily say that. I mean, I'm not making the case that every case of dysbiosis is a sulfur problem necessarily. I mean, of course, there are all kinds of reasons that we can end up with our guts in a wreck, and also I don't actually do much testing at all. I mean, I do some, but not much, because ultimately, I mean, it doesn't matter to me what a test says. If I do an intake and somebody tells me that they not only do they have indigestion, but they have brain fog and maybe some anxiety, or even panic attacks. If they have red skin, rashes, or any red, I mean, sulfur is just hot and eruptive, so skin
homeopathically speaking as well, I guess.
Totally, absolutely. Great picture. And, people who are they're just sitting in front of you, and you just see that their cheeks are kind of red, and they just have that red look to them. And then you ask them how they do with a glass of wine, and oh my God, I'm sweating all night if I have a glass of wine. And,
well, see, but I like it's so. That's why I love talking to other practitioners, because it takes all kinds, right? Some people love to test. I'm one of those people,
yeah, sure.
And we get good results. You get good results, but like I would think more maybe histamines, with
and
wine
totally
and things like that.
So, yeah,
interesting.
And so I'm glad you brought that up, because I mean, certainly histamine has a lot of overlap with sulfur, and some things that distinguish those two. Histamine will, for example, you much more commonly get headaches with histamine, much more commonly get diarrhea with histamine. Histamine, you end up with a fast heartbeat. Hydrogen sulfide is a vasodilator, and so you get people who have positional, orthostatic hypotension. They are more likely to have low heart rate as opposed to high heart rate. Heart arrhythmias are also not uncommon at all with sulfur issues. There is overlap for sure. But generally, we just, if they check enough boxes on that they're allergic to sulfate drugs, and they, they have a hard time with alcohol, and they have a hard time with, we ask them about the high sulfur foods. Sometimes they say yes, not always. I mean, it's not uncommon at all that we'll say, how do you do with eggs? And they, eggs don't sit very well in my gut. So they're not eating eggs. They found that on their own, or they, oh no, I can have a little bit of garlic, but not too much, because that's a problem. And so it's like and then of course asking them how they do with, just asking about alcohol. So whenever people they are saying a lot of things that match up sulfur, and they probably are going to have an alcohol issue too, and then we just put them on the diet, and it's like, oh yeah, look at that. Just another, I mean, I could run through just in the past week the follow up with patients who, it was just crazy to me how much they can transform in a very short period of time. And these are people who've tried, they've tried everything. And often I try the sulfur diet because it's something they've never tried before, even if it doesn't necessarily match so well. It's just like, oh, well, they've never tried this, let's do that. And then it works. So
now, of course, I'm completely sitting on the edge of my seat for your sulfur treatment. I mean, I'm pretty familiar with the low sulfur diet, but just for our listeners, can you go through what's involved in, okay, so you have a patient that fits these criteria, and if I just summarize, it's orthostatic hypotension or low heart rate and potentially some arrhythmias, sort of reddish features, potentially, not always, reaction to alcohol, reaction to eggs, and potentially other foods. Do you have any other sort of like little red flags that you use to determine whether or not this person is sulfur sensitive?
Yeah, any heat symptoms for sure. So night sweats, or even just hot at night, that's certainly a biggie. What else? Sulfur.
What about like sleep problems or something? Do you like, or what about the classic, the symptoms that hydrogen sulfide itself can cause, which is, increased colonic nociception or hypersensitivity, those kinds of things, like cramping pain?
Totally.
Yeah?
Yeah. Of course, I forgot to mention the gut stuff. So people that have, all kinds of any gut issues, I am suspicious that maybe sulfur is involved. It's not always. It's not every time somebody has a gut issue we're doing this with them, because if they don't have any of the other kind of red flags. But
well, I just have so many people that can't tolerate any alcohol at all. I have to actually tell them to put the tincture in hot water and let it evaporate, because that's how sensitive they are. So I'm immediately thinking, I never thought, I'm thinking more aldehydes and alcohol dehydrogenase and those kinds of things rather than sulfur. So that's interesting to me.
But it's just it's that molybdenum cofactor that links the two. And so if somebody is, for whatever reason, either low dietary intake, or they are, I always ask about glyphosate exposure, because it will chelate molybdenum. And so,
most people don't even know. Here in Australia, it's on wheat crops and all different kinds of crops, but we don't. Yeah. It's not something that we always think of Australia as being fairly clean, and we don't. There's certain GMO is not allowed in. So we have a relatively clean food supply, but we certainly have glyphosate exposure. We have nutrient depletion and all of the stuff that goes along with just eating food.
Right. And molybdenum, we just need tiny amounts of it, which means that if you only need a tiny amount, it doesn't take much to chelate that out. You bind up even a little bit of it, and you're going to be messed up. So, whenever people have really strong alcohol issues, a high suspicion, it doesn't mean it's also a sulfur issue, but certainly if people have the sulfur symptoms, you can confirm that to some degree by asking them how they do with alcohol, and they almost always will tell you, oh yes, I can't do that. Or they'll say, I used to be fine in college, I did that college thing, but now it just wrecks me. And so they've quit. So anyway, so those are the kind of things that come together. And so, so you asked then, what does the process look like?
So what is the low sulfur diet? There's a few versions out there. I use Dr. Yarnell's, low sulfur diet. Do you, talking about thiols and sulfur containing meats and stuff versus thiols, and then also really, really wanting to know, besides molybdenum, what you do to help promote the production of sulfate from sulfide.
And actually, something that I'll just want to speak to right quickly, and that is about thiols, because I know that, I've read on the internet, there's all kinds of stuff about sulfur and thiols and their importance. My experience is that thiol sulfur is not that big of a deal in terms of reactivity for people. And I don't know how to explain that really. Certainly meat, for people who are eating meat is by far and away the largest source of sulfur that we get exposed to. But I have had, out of hundreds of people that have been reactive to sulfur in various dietary sulfur, one hand could count the people that react in any kind of significant way to meat, which I don't know. I can't explain that. Now, there are a number of people, actually, I should qualify that. I would say to red meat, which of course is the highest sulfur source. Yeah. That's extremely rare that I have had somebody. Now, I'll say that when I did have those, I can think of two people, and when they reacted, wow, did they react. It was major. But it's been very, very rare that I have seen a reaction to red meat. Now, chicken, I have seen reactions to chicken much more commonly, but I don't think that's a sulfur thing. I think that's an allergic reaction to chicken.
Well, I would think of even to red meat, like when somebody comes to me with a red meat issue, I think of mammalian meat allergy with tick-borne and alpha-gal and all that. So
yeah, it could be. Yeah, maybe there is no kind of sulfur issue, but with the meat, it just seems odd to me that as the highest source of sulfur, it's not a big source of reaction. Now, the foods that react, by far and away, like so far beyond any of the other reactive foods, is garlic. It's just unbelievable how many people are reactive to garlic, and some of them in a astounding strong way. And we've had two people now who were unable to get off their opiate painkillers through all kinds of other therapies and tried a low sulfur diet, this process, and all their pain went away. Just getting, and for one of those two people, even little tiny exposures to garlic to sulfur of the high sulfur foods, in almost any amount of those, pain will come back. Another one, it's much more specific, and I think it's just a couple of sulfury foods that they cannot tolerate. But the most reactive food is garlic, without question. And then kind of going down the line in order of reactivity would be probably eggs are second, and onions are third, and kale is one of those. Wow, there are a lot of people that are reacting to kale, which is surprising. And I'm not totally sure if the kale thing. Of course, I'm not sure with any of these foods, but kale, it could be the garlic, or it could be the sulfur. But there's also this weird thing going on with kale that more and more people know about it now. Kale accumulates this heavy metal thallium. And I kind of stumbled upon this because I had a patient come in and who had all these kind of fatigue, malaise. Wasn't really a classic kind of sulfur picture, but I was just curious what was going on. And we ran to red blood cell heavy metal, and she had a huge amount of thallium in her red blood cells, which is like, what the heck is that about? Like, it was like, I never really, thallium's not really on my radar as a heavy metal. So anyway, doing a little homework, and lo and behold, their thallium is taken up preferentially within kale, and apparently in much of the water they're used, at least crazy United States, we use wastewater as fertilizer in agriculture, and so they spray it on fields, and some of this wastewater contains high levels of thallium. And so the kale takes it up, and then people eat their healthy smoothie in the morning and they cram it full of kale, and that's exactly what this patient was doing. And she had all the symptoms of kale, or the kale toxicity, of thallium toxicity. So, when you look that up, it's all like fatiguey and all kinds of things. So, but beyond just a thallium issue, I do think that kale is one of the more reactive sulfur foods, because we just have people get these foods out for 2 weeks and then they start a reintroduction process. So that isolated reintroduction thing. And it's not at all uncommon that when people reintroduce kale, they do not feel good. So anyway, we got garlic and eggs and onion and kale, and those account for probably 85% of the reactive foods. Then there's a decent number that will react to garlic, cabbage, Brussels sprouts, asparagus, all the stuff that's really healthy, right? Like, that's part of the counseling we got to do with people, is because people come in, often like taking garlic capsules and eating lots of this stuff.
Well, it's very often something that we do for SIBO, for methane-dominant SIBOs. We give high allicin garlic,
Totally.
So I'm wondering if that still applies, if it's an extract and it doesn't have all the other bells and whistles of garlic. But I would assume so, because it still smells like garlic. And that's the sulfur smell. Right. And they actually, in research, use garlic extract to increase hydrogen sulfide production, and it very rapidly does that, the garlic. So it's an interesting thing. So just to get back to your diet, though, what about other brassica families, like cauliflower and broccoli?
Yeah, they all go out. Yeah. It all goes out for the diet, yeah.
So mostly you focus on vegetables, like, Dr. Yanel in his book, in the, I can't remember. It's the gastrointestinal, the naturopathic foundations of gastrointestinal diseases or something like that. I should really know this because it's on my shelf. But his diet does also eliminate red meat, and chicken and fish is allowed. So just interesting that you leave the red meat in.
We actually have people eliminate. They're vegetarian for 1 week, and then they can reintroduce. They can reintroduce red meat. I think we leave chicken out for the whole thing. Chicken, it kind of weirds me out. I think something's wrong with chicken. But anyway, we do a limited kind of meat elimination reintroduction. But the vast majority of reactions that we see are with one of those things that I've listed. And then once we identify the reaction, and it is typically a very obvious reaction, we don't have to guess, and the patient knows right away. So we get them all reintroduced, and then we do the kind of stuff that help. I mean, if we're just assuming it's a toxicity thing, then we do detox, right? So we do infrared sauna, which I think is enormously important for detoxification. We supplement with. We supplement with molybdenum. Am I supposed to say company names?
Yeah, you can go ahead. You can go ahead.
Okay. Yeah. So we had tried several different kinds of molybdenum, knowing, just it must be an important component of this whole thing. and had probably either people didn't seem to respond at all, or people had like would get like Hertz reactions, like sudden bad detox reactions when we would give them fairly low doses of some of the kinds of molybdenum that we use. Anyway, what we ended up doing was with Biotics, one of the companies that we in our clinic we use a lot of. Biotics makes an organic molybdenum. It's called Mozyme, and we use one more Mozyme Forte, which is it's a food-based tablet. It's based on a sprouted lentil, but it has 150 micrograms of molybdenum, not a huge dose. But we had the patient chew up, not swallow whole. We have them chew the tablet up twice a day, and it sometimes even just doing that people will tell us that they can think clearer. And like if somebody says, well, I can't start this diet until next week, and we'll say, well, look, go ahead and start this, just chew one of these up twice a day, and they will tell us that they notice a difference as soon as they start using that particular molybdenum. And in fact, Maria, in her one time, she was doing an intake with a patient who was all brain foggy and sulfury and everything. And so she had a bottle of Mozyme in her office, and just as the patient was talking, she just took one out and told the patient to just chew this up while you're talking. So, I mean, she didn't tell her what it was or anything. So the patient just chewed it up and kept talking. And in about 20 minutes, Maria said the patient was like, what was that you gave me? I feel like suddenly my head is cleared up or something.
Wow, that's amazing.
So it was even that quick. So I think that particular kind of molybdenum, I don't know what it is. I mean, Biotics has a unique way of doing their stuff. So
yeah, I like their stuff. We can't really get it here in Australia, but patients can get it if they really want to,
Yeah, right.
Can order it themselves for personal use and stuff.
Yeah.
So it's usually how I deal with that. So besides, because I do Trithorn, molybdenum picolinate, and with sort of, I'm not seeing any sort of light bulb moments with that product, but So
the one we had been using, Allergy Research has a liquid, and we were happy with it. It was just so provoking in patients that we were having to do this really careful drop dosing of it, and it just was sort of a pain. So then we got turned on to this Mozyme, and the guy at Biotics just suggested, just tell your patients to chew it up instead of swallowing it whole. So we thought, all right. And it works great. And we had people swear by it. So
besides molybdenum, what else are you using?
Yeah, so besides molybdenum, let's see, some other things that we do. Well, certainly there is people that have a lot of bloating or gut issues going on. We use, again, I mean, most of these are going to be our Biotics products. They have something I think it's called Bio HPF or so. I can never remember. They have a bunch of letters in their products, but it's bismuth. It has bismuth as well as some other demulcents and DGL and some other stuff in there. But bismuth in particular will reduce hydrogen sulfide production in the gut. So for people that are just kind of miserable with their bloating or discomfort there, we use butyrate, which we use a lot of butyrate. I think it's the most underrated gut nutrient that there is. It can be just fantastic.
And also you use that from, I mean, I use it from different companies, but you mainly stick with Biotics with that one?
Well, Biotics has one that I use a lot of, butyric CalMag. They use a, I mean, because butyrate is pretty intense in terms of its, the smell and all that. And so they add a little bit of flavoring to it that a few patients have reacted to. So if we're not using theirs, we use Apex as Enterovite, which is another that works really well also. But pretty much every patient gets butyrate in one of those forms. They get a digestive enzyme. We'll give them molybdenum, if they're really like headachy and fatiguey, brain foggy, then we do injections with hydroxycobalamin because that will lower hydrogen sulfide in the blood. Or we'll have them just, if it's not that bad, we'll have them do just a sublingual. But it needs to be in the form of hydroxycobalamin, not the others, because the others don't impact hydrogen sulfide.
I read a study about zinc acetate, and zinc is actually a good binder for hydrogen sulfide. So I've been doing really pretty hefty doses of zinc.
Interesting. Yeah, that's a good idea. And glyphosate strongly chelates zinc. So that one is one that's not, I think is commonly depleted in a lot of people. That's kind of, there's other things that, it's more like symptomatically that we will do if we need. I mean, of course, if somebody needs adrenal support, we do that. If they need DHEA, we'll do that.
And other detox support, I assume, along with your far infrared sauna. And what about colonics and things like that? If we're talking detox,
yeah, we have people actually do lots of. We're having people do coffee enemas on a pretty regular basis. Colonics, I don't have a problem with that, but coffee enemas are very accessible, and they have a lot of great properties. With the chlorogenic acid and the other different components in there that are good for glutathione production and moving bile and all that kind of stuff.
I do recommend them a lot too. So, good old naturopathic protocols that are always really
Epsom
helpful.
Salt baths. I think Epsom salt baths are fantastic because Epsom salt, of course, is magnesium sulfate, and everybody needs magnesium, and these people all need sulfate. And so it's not going down the tube, so you don't run into the bacteria that can generate the bad things.
Right, okay.
You increase sulfate. And there's exactly one study, and I'm so glad it was done, where they had a group of healthy people and a doctor measured their blood magnesium and their blood sulfate levels and had them do an Epsom salt bath every night. And he measured their blood sulfate levels just every day to track their magnesium and their sulfate. And the magnesium went up for a few days and then leveled off because it can't go too high. Sulfate levels went up every day or every night after every bath for 7 days. It went up consistently, and then it topped out and it leveled off, and it never went up above that, even though they kept doing more baths. So the point is that there's a pool of sulfate that the body needs to fill up, and once it's there, it's not going to get any higher. But Epsom salt baths, even for people that are very reactive to dietary sulfate, they will often feel great with an Epsom salt bath because it's a way of getting sulfate in that's not a reactive entry. So, and the study that looked at this used 4 cups of Epsom salt per bath. So it's a lot of Epsom salt.
It's actually, like when I tell people to do an Epsom salt, I just tell them to do a whole liter, which is basically 4 cups, and or even more. When you think about some of these, or even like those flotation tanks, the womb-like environment.
Sensory deprivation,
sensory deprivation. That's right. Where it's just like basically, I think 300 kilos of Epsom salt per tank or so.
Wow.
Yeah. So you basically float out of there. But one thing you said about the diet that was curious to me is that you said that you took everything, took people off of meat and sulfur foods for a week, and then you reintroduced them. But what I didn't really understand is, if they have a sulfur problem, why reintroduce thiol foods or foods that are obviously high in sulfur? Are they really reactive into individual foods, or would it not be the whole food group?
Almost everybody. There are very, very few exceptions to this. Most people are highly reactive to 1, 2, maybe 3 sulfur sources, and they do fine with the others. And if they are fine with the others, it's enormously important that their diet include them, because of course sulfur is so important. And I I can't explain why this is, but the people who are the most reactive, it really is. The number that are reactive to garlic and eggs and kale is by that far exceeds the number of other kinds of reactions. And often after we do detox, kind of supplying a lot of molybdenum to displace whatever might be blocking that spot on the enzyme, people can bring those foods that they were highly reactive to, they can bring them back in. Now, not in the same, like stuffing kale in your smoothie every day, not like that, but can, in kind of more sensible, low-level ways, they can bring it back into their diet and they do fine. Not always. There's some, in fact, it's not uncommon at all that people, especially with garlic, they can't even have a whisper of garlic or they get a migraine or something.
So do you find, I know you said that you don't do much testing, and so it's hard to know whether or not the digestive cases that you're treating are really hydrogen sulfide SIBO or just, it's any of these other issues with hydrogen sulfide production in the large intestine. We don't really know. But for you, it's not uncommon to see the resolution of digestive symptoms when they remove those foods for a while, or at least unclog those pathways, it sounds.
Yeah, these are, and this is how I got into SIBO at all. Like wasn't even something that was on my radar. And then it kind of, I just started talking and writing about this whole sulfur thing because I was so blown away by it. And then SIBO patients sort of found me because there's such a close relationship between sulfur and the gut. And so these SIBO patients would show up and I didn't know how to treat SIBO. Like that's like a whole thing in and of itself, and it wasn't my specialty, but I thought, well, what the heck, let's just try this sulfur program and see what happens. And it was really shocking how many SIBO patients who come in with their test results and they're high on methane or they're high on the hydrogen, and we would just do this process and their symptoms all resolve. Like they would just go away, which led me to believe, and I actually do believe, and Stephanie's writing a paper on this right now, I think. I think that the sulfur imbalance underlies the methane issue and the hydrogen issue are downstream from the sulfur issue.
Can you elaborate on that? I get the hydrogen. I don't get the methane so much because it's basically a different organism altogether that creates a totally different gas. So hydrogen is required for hydrogen sulfide production, I guess, but how do you, what's the connection there?
Yeah, what is the connection? Well, I'm waiting for Stephanie to work that one out. But, well, empirically, what I would say is it doesn't make sense to me that somebody with a high methane SIBO who does the low sulfur process would have essentially complete resolution. Like to the point that I always ask patients, if you felt like you do right now, would you seek out a doctor? And you say no, they don't have any more digestive issues. And these are, I'm thinking of a particular patient with high methane. So I don't know how else to explain that.
I could imagine, we're pretty good with thinking tangentially. So, if I'm thinking about an organism like Methanobrevibacter smithii that produces methane that requires 4 hydrogen for the production of methane, and you're upregulating hydrogen production in order to produce hydrogen sulfide, if that's your theory, then it could follow that you're then, subsequently also sort of feeding hydrogen into that methane production, potentially. That would be my thought. I'm sure there's many other explanations of that, because Methanobrevibacter smithii is actually not a pathogen, right? It's not an organism that has individually been linked to the amount of damage that we can see with with hydrogen sulfide production on the colonocytes and stuff. So Methanobrevibacter is sort of like the way I think of it, it's an evolutionary organism that we've evolved with that is not linked to any, sort of pathogenicity other than constipation, because the idea was to slow things down so that you could extract more calories from your food from an evolutionary standpoint. So, I may be totally off base, but that's what I would think. If it's true what you say, that we're upregulating hydrogen sulfide production, we first must upregulate also hydrogen.
Yes.
Or maybe not.
Well, I'm not sure. I mean, I guess I don't know how abundant hydrogen would be already. Hydrogen, I don't know. I don't know quantitatively if there really is not enough hydrogen around that you would be able to make, I would think from even the ambient water that bacteria would be able to extract hydrogen from that. But I don't know. I don't know the biochemistry that well.
Well, there are also acetogens and other organisms that pump out the hydrogen,
Yeah,
so I'm very curious about that link, and I'd love to see this paper.
Stephanie is thinking, her line of thinking is that especially with glyphosate toxicity, what happens is glyphosate, through a lot of different things, interferes with the microbial production of methionine. And if you can't get carbons incorporated, the carbon that you need incorporated into methionine, that's a perfect substrate for, and also not only get carbon incorporated into the organic molecules that you're trying to build, but if you can't get sulfur incorporated into the sulfur molecule that you're trying to build, that is a perfect substrate for microbes to pick those carbons and sulfurs up and generate methane and generate hydrogen sulfide as sort of a byproduct of a disrupted metabolism that happened prior. Talking right now, this is very much, I'm sure she's working it all out. This was through a series of exchanges that she and I had some weeks ago, just trying to piece together how would, in the SIBO environment, how would you end up with those particular gases being produced? Like, why in SIBO are we growing certain bacteria and not other bacteria? Which seems to me kind of with dysbiosis, you can have all kinds of weird bacteria growing. Why is it that SIBO has just these bacteria?
Well, I think that could be the topic of a whole nother podcast, because we can, I have a lot of thoughts about that. And I'm not sure we can equate, we know that the environment in the small intestine is so very different from the large intestine, right? Completely different. And there's so many different reasons why people have SIBO and grow those bacteria. And there's so much interplay, especially with hydrogen. Like I said, there's hydrogen reducers and producers and all kinds of different things that occur. And those are just the two gases that we happen to measure. Now, with methanogens, methane, it tends to be high in people that live next to landfills, for example. It's not always just linked to SIBO. There's a lot going on there, and that's because methane is produced in very, very high amounts around landfills. So there's a lot of thought, but I love it that there's so many people thinking about that and what we now know about the microbiome, and we're just in a way still to this day peeking over the fence of all the things we're going to find out. That's the exciting bit of learning more and understanding more and making those connections. So, look, we're unfortunately out of time. I have a million more questions. We didn't get to any of the ones that I sent through to you. We did peripherally, but that's what I love. We just get to talking about things that really matter, and I think this has been so helpful, I think, to a lot of practitioners out there, and I'm certainly going to try what you've suggested a lot more in these patients. So I really want to thank you for coming on the podcast. And do you have any other sort of little nuggets that you want to throw out there when it comes to hydrogen sulfide or sulfide in general?
Oh gosh, nuggets. I would say just I would be so psyched if people just start trying it out and send me a note and tell me what happened, because I can't be the only person who gets results with this. There's no
I'm
way.
certainly going to try. I will. So what is the email or the contact that you want people to contact you on? And also maybe say your website, although all of that is usually in the show notes, but certainly you can plug your clinic at this point.
Sure. So I'm at Immersion Health in Portland, Oregon. That's at immersionhealthpdx.com. I can be reached at Dr. Nigh, DRNIGH, at immersionhealthpdx.com. What else? Yeah, I mean, that's all the plug I need to do, I guess. But would be totally psyched to hear feedback from anybody who tries this process, and because I really do think that there's a really close tie between disrupted sulfur metabolism and SIBO. I don't think it's 100% explains all SIBO, but I think that there's an enormous overlap between the two, and that unresponsive patients or poorly responding patients may do really well if it's approached as a sulfur issue.
I can't wait to try it out, honestly, and you will hear back from me. So I'm definitely.
Thank you for having me. I really appreciate it.
My pleasure, and we'll see you around, and maybe have you back on the show when we have more data some notes to compare.
Excellent, and we can get into all those other questions.
Yeah, thanks a lot, Greg.
All right, bye-bye.
Thank you.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.